Welcome once again to ASA TV. I'm Ed Highland. I'm joined now by Dr. Ron Harter. Thanks so much for coming by. Member of the PSH Learning Collaborative Committee, Steering Committee. And we're here to talk about the PSH and give us some thoughts, if you would, as a physician who at your institution, Wexner, came up and instituted a PSH service center. Give us some thoughts on that, the how, why, when, and where, if you will.
Sure, yeah, happy to. We began this conversation with our involvement in the initial Learning Collaborative about 2015. We entered into that, and that really began the conversation for us to engage partners throughout the institution: surgeons, administrators, nursing, pharmacy, IT. And then we began enrolling patients in our first pilot about a year and a half ago, spring of 2016. And since then, we've added a second service line, and we're enrolling patients every week, and we're seeing tremendous outcomes from that.
Were there any roadblocks, if you will? Give us some thoughts on, if there were, how you overcame them.
You know, the real challenge is just this is a heavy lift, and it requires a lot of people to be engaged for it to be successful. So it's a lot of meetings, a lot of conversations, a lot of planning to get to the implementation phase. There's really no single part of it that's really rocket science. It's more just implementing the things that we do some of the time, in some cases, to becoming more of the sort of the standard way that we do patients within certain populations.
Give some thoughts, if you would, on some of your results. What have you seen, and what has happened in the way of improvement for patient quality?
Well, and that's really been one of the great affirmations for me of seeing how good the outcomes have been. We've had, in our first pilot, which was mastectomies with immediate microvascular reconstruction, we reduced length of stay by a day, which is significant, and which definitely saves expense on the health care of the patient. And then even more, I think, significant, we reduced our opioid administration in the postoperative period to about a third of what we historically had been giving. Then with our second service line, which we started spring of this year, 2017, we with colon resections, both open and laparoscopic, the length of stay has been remarkably reduced. Historically, we were at 11 days, which is towards the lower end of what you typically want to see. So that was certainly the low-hanging fruit opportunity for us. But with implementing the surgical home practices on that patient population, we've reduced our length of stay to just over 5 days. So really significant, and likewise dramatic reductions in the opioid administration that we're giving to our patients.
Have you thought about where you might be going from this point?
Yeah, that's really, it's we're I think victims of our success at this point. There are a lot of surgeons and subspecialty surgical groups that are queued up that they want to implement this as well. It's becoming, I think, more broadly recognized across all of the surgical disciplines that there's so much opportunity here to really improve care, reduce cost, improve patient satisfaction, that it's really, we just need to sort through and decide kind of what programs to implement next.
So you're being cited as a model, as an institution that perhaps others look to gain ideas how to set up their own PSH?
Well, I think we weren't the first ones to come into this space. Certainly, University of California, Irvine, as well as UAB, both have been doing this for a few years, and I think we learn lessons from the other places that have already had it in place. But I do think we're now at a point where we can be helping to share our message and our advice of how we were able to put it into practice.
Well, certainly kudos to The Ohio State University.
Thank you,
Dr. Harter,
much.
thank you so much for joining us.
All right.
And this is ASA TV.